Thank you, Tom. And when I was told I was following so many politicians, I figured I'd be here till dinner time, except we seem to be moving along. And I do want to thank all the congressmen and women who are here today, especially, not to single out one person, but especially Congressman Davis, who, working alongside great pro-life Democrats like Bart Stupak, has made sure that this has been a bipartisan process. Now, when Congress introduced Medicare in 1965, it was estimated it would cost about $12 billion a year. The actual cost was $110 billion. When Congress made some changes to Medicare and Medicaid in 1987 and 88, it estimated it would cost $6 billion. Its actual cost was $27 billion. Now, in the same week that we learn that we're running up a $1.4 trillion deficit this year, we are told by our Nobel Prize-winning president that we'll not add one dime to the deficit. Obviously, that prize was not for economics. Now, original estimates place the bills at $900 billion. However, when you add in that we'll start being taxed for it immediately and don't see any changes for a number of years, the actual price tag runs up to $2.8 trillion. Now, what does this have to do with a press conference on abortion and health care, you might ask? Some might be scratching their head because you were told there wouldn't be any math today. Well, there will be irony. Now, as we speak, Senate and House Democratic leaders are meeting behind closed doors with a handful of White House staffers to craft health care overhaul language to be voted on by both chambers. And I guarantee you, despite what the president says, this bill will force taxpayers to subsidize abortions. They can't help themselves. So as we add to the debt of our future generations, we do so with a bill that would seek to eradicate many of those potential taxpayers. We cannot barter away the fiscal and moral future of this nation to satisfy an abortion industry that takes no prisoners. We urge all members of Congress to vote against the expected bills coming from the White House and to start from scratch for true health care reform that America needs.